far distance, to moon, to stars or aeroplane, something like that. So he or she will get some distance training. That's the most important thing. So what we are at risk is more near work for the kids.
Okay. How we can identify the kid is having any vision problems?
Yeah, that's another important thing. If the kid is having some refractive error like myopia, hypermetropia or astigmatism, he will show some signs actually. There can be too much water from the eye, or there can be a deviation of the eyes, what we call squint. There can be a misalignment between the eye or abnormal head position. And most kids with the refractive error like myopia, they will squeeze their eye. They will make their eyes small, and so if they make their eyes small, they can see more clearly.
Okay.
So it's an involuntary mechanism by the kids. They will squeeze their eyes and see.
Okay.
So any watering, any deviation of the eyes, any abnormal head position, or any squeezing, we can think that the kid is having some problem, and don't hesitate to consult an ophthalmologist for that condition.
Okay.
Because unidentified refractive error can be a dangerous thing for kids. Okay. It's another sort of silent killer of vision for the children. Unidentified refractive factor the kids can develop amblyopia or lazy eye.
Okay.
Once the amblyopia or lazy eye develops, it's very difficult to treat. Okay. So under the heading of silent killers of vision, we can coin this amblyopia also.
Okay.
So this online classes and too much near work due to the kids can develop amblyopia.
Okay.
Once the amblyopia sets in, the treatment is very difficult.
Okay.
So we can add one more under the heading of silent killers of vision.
Okay.
Apart from glaucoma and diabetic retinopathy, mainly affects adults.
But
for the children, the silent killer of vision is mainly the amblyopia. Unidentified refractive error, unidentified myopia or short sight can develop lazy eye.
Okay.
Our kids' eye can become lazy.
Okay.
For the adults, it's not the scenario. The lazy eye is very rare in adults. So for the kids, they can. So don't hesitate if your kid is showing any signs, any problems for their eyes. Don't hesitate to visit ophthalmologist.
We have a question from James Franco.
Okay.
If anyone has sugar or diabetes, is it mandatory to check vision?
That's a very relevant question. Actually, individuals with what is the question?
If anyone has sugar or diabetes, is it mandatory to check vision?
Yeah, I will tell it is mandatory actually. It is not only mandatory to check your vision, it is mandatory to do a dilated examination also to identify diabetic retinopathy.
Okay.
As also you have to check your intraocular pressure also.
Okay.
So an individual with sugar should undergo vision testing, intraocular pressure testing, as well as dilated retinal examination to know if he has some diabetic retinopathy, something like that.
Okay.
Because diabetes can affect the vision. Diabetic individuals can develop refractive error also.
Okay.
So some individuals with refractive error we can correct by giving some glasses.
Okay.
If glaucoma is there, we can treat with some eye drops. If diabetic retinopathy is there, we can treat accordingly for diabetic retinopathy also. So every individual with high sugar or diabetes or borderline diabetes should do a vision test, diabetic retinopathy dilated evaluation and intraocular pressure.
Okay.
How frequently means it depends. If the patient already developed some diabetic retinopathy or glaucoma, he should undergo some 6-monthly or 3-monthly evaluation.
Okay.
If the patient doesn't have anything in the first examination, then we can have some yearly checkup. Every year you have to come and do this test.
Okay. Will it has any effect in future? Is the same guy asking.
Yeah. So that's the thing.
You explained earlier.
It can get affected.
How does it done? He is asking that how we can test, we can done how. Can the same like dilation and
It's actually simple. The only thing is that we will put some drop into your eye so that eye get dilated, and we will do a testing everything accordingly. But the problem is that you should be accompanied by an individual. That's the ideal scenario for dilated eye examination, because after dilatation your vision will not get affected, but you will feel too much, if too much light enters your eye, you will have some difficulty. So you should be accompanied by an individual when you are coming for that test.
Okay. So after that, driving is
after that, driving is not advisable.
Okay. For how long? For 1 hour or like that?
The test will be completed within 1 hour, but the effect of that drop will be there for some 4 to 5 hours.
Okay.
So if you are coming at night, for the testing, you can go to sleep after that. By the morning, it will be okay.
Okay.
Absolutely okay.
Okay. We can come back to the other topic, like children's case. So how frequently we can do vision test for the children?
Children from the age of 3 or 4 years, we can do the normal vision testing. If the kid is not in a position to read alphabets or numbers, we can do cycloplegic refraction. We will put some cycloplegic drops into the kid's eye, and we will do computer eye testing and retinoscopy. And we can identify the refractive error of that kid. So if the refractive error is too much, we can give some glasses for some time. And for the kids, better every 6 months follow-up is better, because kids' power can change very fast. Eye power can change. So every 6 months follow-up is better.
Okay.
Yearly is a must actually for the children.
We have a question. We are doing dilation for retinal checkup. How much it's cost, and it is expensive or not?
It's when we are looking at the result of that dilated examination, it's very cheap actually. It's nothing. Some 75 or 100 riyal we can do the dilated examination, everything. Actually, its result is small. Okay.
And then come back to our kids section. What are the advice to parents as a doctor?
So my advice to the parents is encourage your kids to have good distance vision. Encourage your kids to look at far distance, because we are living in an era where we are forced to live indoor most of the time.
Okay.
So if possible, take your kids to just outside your room or just into the balcony and ask the kids to look at far distance and reduce the screen time. That's the main advice I have for the parents. Apart from online classes, reduce the usage of smartphone, PlayStation, TV, laptop. So reserve the uses of this smartphone only for education, not for games, something like that. And encourage your kids to have other games, other outdoor games or indoor games like badminton, cricket, football, something other than the computer games. So anyway, computer or a smartphone is needed for online education. So encourage other outdoor or indoor games other than computer games. So don't encourage your kids for computer usage apart from online classes. Then bring your kid to an ophthalmologist if the child shows any signs of vision trouble. Just like I said earlier, any watering from the eye, any squint, any deviation of the eye, any squeezing of the eye, any twitching, too much twitching, something like that.
Okay, thank you so much. Thank you, doctor, for spending valuable time with us.
Thank you.